Welcome everyone to day 4 of Virtual Wish 2020. And we're going to begin with a discussion about Islamic ethics and infertility treatment, building on this year's Wish report on this subject, which has looked back at the history of techniques such as IVF and those of the present day and the future, addressing ethical concerns from an Islamic perspective.
Was born. Today, around 3 million babies come to the world every year as a result of IVF, but artificial reproductive techniques are going way beyond it and along many moral dilemmas. Welcome everyone, wherever you are. My name is Rawa Oje, and I will be your host for this panel, part of Wish 2020. Today, we talk about surrogacy, uterus transplant, cryopreservation, embryos donations, and way more, with a lot of moral dilemmas, such as, is it ethical to do IVF using frozen sperm of a diseased husband? Or if surrogacy is not acceptable to avoid mixing genes, what if the surrogate mother is from the immediate family, like the controversial story of the grandmother who gave birth to her son and daughter-in-law's embryos? And there are way more complicated dilemmas to which neither the medical nor the religious community have answers yet. But today, we will present the latest recommendations on ART, or artificial reproductive techniques, in terms of Islamic ethics. Let's welcome with me members of this panel, Dr. Muhammad Ghali with me here in the studio, Professor of Islam and Biomedical Ethics at Hamad bin Khalifa University, HBKU in Qatar, and the forum co-chair. We have with us also the second co-chair of the forum, Dr. Alia Abdelhadi, Chair Assisted Reproductive Center at Hamad Medical Corporation, HMC. We have with us Archbishop Vincenzo Paglia, President of the Pontifical Academy for Life. With you, we will have a quick overview on the Catholic Church's take on ART. We have with us also Dr. Soraya Tremian, Founding Director of Fertility and Reproduction Studies Group at the Institute of Social and Cultural Anthropology at Oxford University. We also have with us Dr. Faisal Al-Kak, Vice President of the International Federation of Gynecology and Obstetrics. We also have with us Professor Jamal Sroor, Professor of Obstetrics and Gynecology and Director of the International Islamic Center for Population Studies and Research at Al-Azhar University. He is also the Clinical Director of the Egyptian IVF and ET Center in Egypt. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. Each member will answer my first round of questions in 3 minutes. Then we will move to the Q&As. So make sure you send us your questions as soon as it comes to your mind. We would also like to hear from you. Tell us where you are watching and from with a photo on social media using the hashtag VirtualWish2020. As you might know by now, leading up to the summit, WISH established 10 forums. Each was chaired and led by a recognized expert in the topic, and published a report aimed at policymakers and healthcare innovators. And Islamic ethics and infertility was one of these forums, co-chaired by Dr. Ghali with me here and Dr. Ali Abdel Hadi, who both of them prepared for us a video to brief us about the report. Let's watch it.
Assalamu alaikum. Hello, everybody. I am Muhammad Ghali, Professor of Islam and Biomedical Ethics at Hamad bin Khalifa University. It was my great pleasure to work on this report, Islamic Ethics and Infertility Treatment.
Assalamu alaikum wa rahmatullahi wa barakatuh. Greeting of peace to all of you. This is Dr. Ali Abdel Hadi. I am the chairperson of reproductive medicine at Assisted Reproduction Center in Qatar at the HMC. Today, I have the honor to meet with you and speak to you about, in short, about our report that we have prepared for this great event. We have worked together to bring up some light on the assisted reproductive technologies, not only by its own as a history and some scientific facts, but also on the ethical and religious dilemma that this technology has brought to the world over the years. At the beginning, you will find in my report some history about the development of the assisted reproductive technology around the world, and in particular we highlighted some information about how we started it in Qatar, which was 26 years ago only, and before that we used to send our patients to have their IVF treatment or assisted reproduction treatment abroad only. Also, we will talk about some scientific facts just to introduce the principle of the assisted reproduction technology to our audience. Some scientific facts will help to elaborate or explain why do we discuss this particular matter, because in the past when it was developed, it was such a simple procedure that is assisting women to get pregnant. But over the years, it has evolved into many other expansions and other advanced technologies, like, for example, gender selection. You can identify even the gender of the embryo prior to transferring it to the uterus. Other than this, pre-implantation genetic testing, which indicates that we even test the embryo, the genetic component of the chromosomes of that embryo before we put it back into the uterus. And the reason or how this would help people with is to identify if there is any genetic diseases transferred from the parents to the embryos. So we exclude these diseased embryos and we transfer the healthy or chromosomally normal ones. Then came more challenging cases to also get pregnant by introducing the gamete donations and embryo donation, surrogacy, and you can name it. So with the introduction of all these scientifically approved procedures, we were faced, or the assisted reproduction was faced with ethical dilemmas and religious conservation all over the world, from all categories of people. Every religion is started to try to answer how these technologies could be compatible with the rules and regulations, and if at some point it is crossing their boundaries. And from this view, we started to discuss also the Islamic approach and the Islamic view in these modern technologies. This is the part of Dr. Muhammad Ghali, the Professor of Islamic Ethics from Hamad bin Khalifa University, that will elaborate on this.
Now I will just give you a very concise summary about the section on Islamic ethics, on Islamic ethical perspectives in particular. The main point of infertility treatment through the so-called assisted reproductive technologies, ARTs as we call them, is that not only that we get children, but we get our own children, children who belong to us. So this is completely different than adoption, for instance. So we want to get children who are related to us in one way or another. So in order to understand the recommendations that we proposed in the report and the positions we took in this study, we need to understand what we call the moral world of getting children who are our own children in the Islamic tradition. There is a moral world. This is what we proposed in the report. There is a moral world or components of the moral world in the Islamic tradition based on three main aspects. The first aspect is marriage. People who want to get children that will be attributed to them and recognized by Islam, they should be engaged with each other through religiously valid marital contract. This contract will produce a set of rights and obligations to each involved party, to the husband who will be the father later on, and the mother who will be, and the wife who will be the mother later on. The second one is the biological or genetic relatedness between the two married couples. It was known early on in Islamic history that both partners contribute biologically or genetically, as we call it, to the composition and the structure of the child. This contribution was called the two waters. One water coming from the husband and one water coming from the wife. Now we call them the egg and the sperm. Before it was the two waters. In order to have two parents, these parents, each of them should contribute his or her own water to the child, that we call now the 23 chromosome, etc. The third element of this moral world was having sexual intercourse, which was the very natural way. Two married couple who will contribute, each of them will contribute the water or the genetic part of the composition of the child, how this will happen through intimate relationship and having sexual intercourse. Was it possible in the past that people would have children without having sexual intercourse? The answer is yes. Very exceptional cases, but they perceived that by having asexual reproduction or asexual procreation through a manual insertion of the husband's sperm into the woman's vagina. This was perceived. This was the pre-ART moral world, the pre-assisted reproductive technologies moral world. When the assisted reproductive technologies came in, these new technologies challenged these three components in some way or another. How did Muslim religious scholars react to these challenges? Concerning the first element, marriage, they didn't make any concession. Those who want to get children also through IVF or assisted reproductive technologies, they must be engaged with each other through marriage. And the two waters, the sperm and the egg, and the whole process must happen during marriage, not after a marriage and not before marriage. When it comes to the biological genetic relatedness, first of all, they made it clear that no third-party donation. So it's not possible to have the sperm of someone else other than the husband, not possible to have the egg other than the wife, not possible to have uterus from anyone else other than the woman, etc. So no third party, no transplanting ovaries or testicles that produce the eggs and the sperms, but there was possibility for freezing one's own gametes or one's own embryos of the married couple. Transplanting uterus was possible because uterus is not transferring genetic material from one person to another. Finally, concerning the sexual intercourse, assisted reproductive technologies can overcome this process by doing artificial insemination. Is this possible? Yes. They said yes, this is possible because already in the pre-modern moral world, the pre-modern perception also anticipated the possibility of having asexual reproduction through the mechanism of manual insertion of the sperm. For the sexual intercourse, it was not possible, even with the modern technologies, to have sexual intercourse through penis, for instance, or vagina transplanted from someone else, because sexual intercourse should happen intimately between two married couple without assistance from someone else from inside. Based on these understandings and discussions and differentiation between the moral world pre and before ARTs and the discussions post ARTs, we came to these key conclusions and recommendations that we would like to propose to colleagues, to policy makers in the health care sector. Thank you very much.
I would like to thank you so much for this great opportunity, myself and my colleagues, Dr. Ghali and Dr. Asha Youssef. We hope that you find this report really useful to all of you. Thank you so much.
We will get back to you, Dr. Ghali and Dr. Alia Abdelhadi, for more questions later on throughout the panel. Now, the first question goes to Archbishop Paglia. You recently expressed the Vatican's support to face global challenges like the disappearance of family. To which point will the Catholic Church go in supporting assisted reproductive techniques to fight infertility, and what are the red lines? Archbishop, you need to unmute the laptop.
Okay. Excuse me. Okay, it is a very great pleasure that I speak. Okay, it is. Okay. Okay.
Yes, it's perfect now.
It is with great pleasure that I speak today at the beginning of this panel dedicated to necessary ethical reflection on the exquisite act of bringing new human life into the world. I would like to thank the supporters of this meeting and all those present, albeit in a virtual form, which, while on the one hand it still allows effective interaction, does not offer us that personal contact whose value I consider irreplaceable. Special thanks go to Ms. Sultan Afdal, Chief Executive Officer of WISH, who kindly invited me to participate in this important event and who once again wanted to highlight the collaboration between the Pontifical Academy for Life and WISH. The cooperation between our two academic realities is a strong and a clear sign of how the religious dimension of human experience strongly supports scientific research, particularly in the medical healthcare field. It does too so passionately committed to men and women, their existence, their lives, especially when they are attached, treated, weak, and in need of attention and care. It does so be committing itself and urging everyone to act responsibly so that the human dignity of every concrete life is fully protected in every activity that sustains and cares for it. The theme that is addressed in this roundtable is of great importance because it touches on the one hand the suffering of couples who wish to have children and cannot, and on the other hand, the first moment of human life. It is therefore an issue where medicine is at a crossroad in which different trends are intertwined, not only clinical, but relational as well. The relationships between wife and husband, as well as between generations, is at stake. Even more, we know how great an impact the family has as the fundamental nucleus of social existence and as a place where kinship structures are formed on which human societies are based. Assisted reproductive technology that is available today can modify the way parenthood has been made possible until now. In fact, it is possible now to individualize and separate the different elements that result in fertilization, which in the ordinary methods of procreation, the only ones practicable until a few decades ago, could not be realized other than in a unified interaction. Just consider the various now existing forms of heterologous in vitro fertilization in which the egg and sperm donors are not husband and wife. We must act with great caution and with a comprehensive understanding vision, because at stake are the pillars that hold up all our social structures. In Catholic thinking, the transmission of life occupies a position of great importance and is understood within the relationship of factors that unify sexual activity, the love between spouses and generation. Our tradition considers this unity as a non-negotiable anthropological truth, one that moreover is engraved in the experience common to all cultures. The bond between spousal love and generation is a gift more than a duty, and as such it calls for our protection. In fact, every child is generated in an encounter between a man and woman, involving all their existence and history, not simply their bodies or the cells provided by their reproductive organs. The experience of birth helps us understand the meaning of human sexuality. Each child is born within an alliance that hosts him or her. Generating is welcoming a child who, although coming to us, does not belong to us. The time of gestation is of enormous importance for parents to be able to process their welcome of the other person who develops within the woman's body, recognize him or her not a foreigner, an opponent, but a guest. The human sex act, therefore, has a profound symbolic reach which goes far beyond what happens in a process that can be described in physiological categories and medical definitions, even though those categories and definitions do provide us indispensable information and knowledge. The meaning of corporeal union is this: in it, mutual gifts are given. It is in the tenderness of an encounter between two bodies that two persons discover with surprise and joy that they can become parents of a third, a person other than them and their expectations. In the act of mutual giving, men and women discover that generation is not the creation of something out of nothing. Each child comes from afar as a favor which parents themselves are no power over. Parents are actors and spectators at the same time, active and passive. They not only offer a gift, they receive one as well. Father and mother are accountable for the gift they received, which becomes real only through them in fidelity to their covenant and in their commitment to educate this other about the gift of life. Sadly, this gift is hidden in the suffering that infertility brings. Evaluation of the various assisted reproductive technologies must take place within this base framework. As it made clear by the survey presented in the report on Islamic ethic and infertility treatment, which you will discuss in the panel, they are not all the same. There are irreducible differences among them. In the case of a homologous assisted reproductive technology, generation is not artificially separated from sexual intercourse because if the spouses are infertile, the act in itself is infertile. Homologous technology is instead as a form of treatment whose purpose is to remedy infertility. The medical procedure, despite all its complicities, does not replace the relationship. It makes generation possible within that relationship. It is, of course, necessary to avoid fertilization of more oocytes than are intended to be transferred to the womb so as not to reproduce surplus embryos destined to remain frozen in refrigerator or discarded and destroyed. Heterologous assisted technologies, on the other hand, significantly change the practical and ethical quality of what the participants do. The donors of gametes are not spouses and do not more than provided biological material, rendering fatherhood and motherhood meaningless. The client couple do not together generate the child that results. The fact that only one of them and not the other contributes to the genetic heritage of the couple establishes a very problematic imbalance in the couple's relationship. That imbalance is further aggravated in the case of surrogacy, given the increasing recognition of the deep meaning of pregnancy and how important the experience of pregnancy is. In addition, turning to the best interests of the child, these technologies profoundly alter the relationship of the child with his or her biological origin, a very important reference point in the construction of a personal identity. To this is connected the problem of the anonymity of the gamete donor and the appropriateness of communicating to the child the circumstances of his or her coming into the world. Several approaches have been proposed, all of them unsatisfactory and negative for the child. In fact, the child is either deceived about the relationship to one of his or her two parents, or If you decide to tell the truth, it becomes difficult with such a confused multiplication of paternal and maternal figures for the child to call its parent father or mother. In heterologous assisted technologies, and all the more so in surrogacy, the participants' ovum body is reduced to a biological object, and the relationships are emptied of their practical and symbolic meaning in the name of an assumed all importance of the desire to have children, who those are not more than the fruit of their desire. In conclusion, this contribution of religious traditions can help not only to identify the ethical criteria that support the use of technologies that respect the dignity of parents as well as children. In more general terms, however, religious experience makes it possible to consider the question within a horizon that transcends earthly concerns and avoids absolutizing a child as something to had no matter what it takes. Every way in which development of human life and fraternal solidarity is supported and fostered is an expression of the fruitfulness of the couple and the family, even if it is not possible to have one's own descendants. It is in this way that we live out our being sons and daughters of God. Thank you very much for your attention.
Thank you, Archbishop. Thank you, Archbishop Palia. If I want to summarize, from what I understood, the Catholic Church opposes surrogacy and opposes donation, which Dr. Ghali also presented with the main findings from the WISH report and the recommendations that stemmed from teachings of the majority of Muslim scholars. Dr. Tremaine, there is a notion that all third-party donors are banned from the assisted conception process. However, it is our understanding that the Shiite Muslims have a different perspective on ART and how they are practiced in the Muslim world. In fact, to date, Iran remains the only Muslim country in the world that has allowed the use of all ARTs in all their forms. Can you tell us more about the differences between the Sunni and Shiite sects when it comes to ART?
Yes, well, thank you very much. It is a great pleasure to be part of this panel. To talk about the differences between the Shia Iran and the rest of the Sunni Muslim Middle East, I must first say 2 points. I'm sorry that my dear colleague, Professor Marcia Inhorn, is not here because she's the leading anthropologist on the Sunni Muslim Middle East and ARTs. And the second point is that apart from the Shia Iran, the Shia in Lebanon also practice ARTs in all their forms. When these reproductive technologies first arrived in the Middle East, they were received with open arms because Islam is generally viewed as a pronatalist religion, and having larger families is very much valued. So it's not surprising that the Middle East countries adopted the reproductive technologies with open arms. However, as Professor Ghali has already explained, the Sunni in the Middle East did not allow the use of third-party donation in any of these forms. That was only allowed between the married or heterogeneous married couples. In that sense, the Shia in Iran also agreed with the Sunni that only the IVF or any other form of reproductive technologies are allowed between married heterosexual couples. However, the Shia have found ways and solutions around allowing third-party donation in all its forms through resorting to independent reasoning or fatwas when faced with new situations. The leading Islamic jurists, the sources of emulation, marja taqleeds, resorted to the Quran and came up with solutions as how and why the third-party donation could be allowed. There are too many ways of fatwas, but I'm not going to go into this. But what is important to say is that the reason the Sunni did not allow the use of third-party donation, and to a certain extent the Shia also allowed it only within the marriage, was because the family is generally viewed as the cornerstone of society and ensures the stability of the society. And the intrusion of the third party can be interpreted as adultery because it interferes with the couple's relationship. It has got the potential for incest because this donation can apply to so many people who may be siblings and not realize it and get married. And it also confuses the issue of lineage or nasab and descent and kinship, and therefore inheritance, because in Islam, only biological relatives can inherit from each other. So there are many, many issues which would be confused through this third-party donation. The sources of emulation in Iran did find solutions, but not every source of emulation agreed. They didn't necessarily agree with each other. In fact, some sources of emulation follow the path the Sunnis have and forbid any form of third-party donation. Another group of sources of emulations allowed it on conditions, certain conditions, and the third group allowed it without any conditions. And there, as I said, they have found many solutions. So this is essentially the difference. And today, Iran has allowed the use of third-party donation in all its forms. And all of these technologies have been approved through fatwas or religious edicts, except for the embryo donation, which no amount of fatwas could justify. Therefore, a law was passed in Iran on embryo donation in 2003. And then the laws of surrogacy also followed the laws of embryo donation. And as the new technologies arrive in Iran, the same predictions are the same fatwas are applied. However, there are certain positions that have created a number of legal and moral issues. For example, the anonymity of the donor. Because to begin with, it was often people resorted to their siblings or relatives, biological relatives, mainly to donate gametes, for example. Mm-hmm. And this had created a number of problems, which in the lack of a law, it was difficult to resolve. And it was the practitioners who took the lead to actually resolve the problems and the difficulties. As a result, the anonymity is a major issue, and the Iranian practitioners have been trying to convince the lawmakers to actually pass a law on anonymity of the donor, which has not yet been resolved, but it's very much a major issue in Iran at the moment. This is the main difference between the Sunni and the Shia.
This is also an issue globally as well for the anonymity of the donator, of the donor. Thank you, Dr. Tremaine. Dr. Abdelhadi, from your experience in the field, how central is religion in the culture of infertility treatment delivery, especially in the Arab region and the Muslim world? How is this different to the experience you had treating patients in the West? Dr. Abdelhadi, you need to unmute your computer.
Assalamu alaikum wa rahmatullahi wa barakatuh. Greeting of peace to everyone. It's such a pleasure and a great opportunity that I get the time to speak to all of you. and we explain a little bit about our experience and our report, which we had the pleasure to do it together, myself and Dr. Ghali, and also with the participation of Dr. Aisha Yusuf from Sidra Hospital. As you asked about how central is the religion in my practice, especially when I practice in the Middle East, as a physician, we follow common rules, and the rules are that wherever we practice, we have to fully understand the rules and regulations and the code of practice of the region wherever we practice at. Regardless of where I come from, regardless of my religion, there are certain rules that has to be respected in terms of different regions and countries. When we come to the experience in the Middle East, we know that most of our rules and regulations, they are closely married, intimately married to the religious instructions and recommendations. So most of the rules and regulations and even the legal law that we follow in the Middle East and in the Muslim countries are extrapolated from the Islamic religion, and with what to do and what not to do related to the religion, which makes it later on as a law or a rule. So understanding this makes the practice of the assisted reproduction, makes the religion intimately close or central to the practice of assisted reproduction, in the sense that of course I have to be, as a physician, to follow the rules and regulations of the country, which allows me to understand what is scientifically approved options and where I can stop for the ones that crosses the religious boundaries. What can be offered and what can't be offered for this particular part of the world. It can be also on a personal level. I think it can be empowering in a way. For example, on an individual level counseling and consultation, when I know the background of the majority of people who lives at that particular part, and I understand their mentality and where they come from, it makes it easy to counsel them, and it makes it easier to explain to them that these are our boundaries and that's what I can offer to you. And because the law is going in line with the religion that most of the people at this area believes in, so there will be no great discussion or argument about why are we following this rule. Actually, on the contrary, the majority will be having a great responsibility and interest to ask and explore if the options that are medically approved and are being offered at the time being for them and ready for them to use on the table are in line with the religious instructions, or does it cross the boundary of the religion, because they don't want to cross that. So also the way it's empowering, and I think I use it sometimes as a way to try and help and heal people psychologically when we come to a stage that we are unable to help, because we can only offer certain things, but at certain point we will have to say we have done everything, but it's just not meant to happen. And not meant to happen in the Middle East means that it's God's wish, and there won't be any further to be offered that crosses the boundaries of the religion and what we can actually service you with. So dealing with a believer, the belief gives a person the power to understand that at some point we will have to accept what God wants for us, or that there is fate and there is destiny, and we can't really defeat that. It's empowering, and it's healing. I found it in many of the situations. Of course, when we go through the hard time and when we are frustrated or depressed, that we wanted something so much and we came to a point that we can't get it, that makes our energy negative, and it takes away all our positivity, and even we forget to remember what kind of merits and blessings that we have. So at this time, for me as a counselor and a physician and a healer, I have to try to strengthen this belief in a person, of their blessing, of their merit, of everything else in life that we have, in opposite to just the one thing that we couldn't have. As for practicing in the West, again, I will go back to the just about the practice in the West.
Thank you, Dr.
I believe.
Yes.
It's just a short note. I believe that the struggle with the infertility is the same everywhere in the world. The difference is that practicing in the West, you have got code of practice. Also, you have to follow, but it's irrelevant of whatever the religion will recommend. And so many, there will be more to offer on the table, maybe for the couple. Although, despite of this, there will be couple or on the individual level that will opt to go with their own beliefs, either religious or social or financial, that might not allow them to utilize all the options that you are offering. So the struggle is the same wherever in the world. Options might be more open according to certain rules and regulations, but still on the individual level, people will tend to select whatever is compatible with their ethical belief system.
Thank you, Dr. Abdelhadi. Dr. Elka, can you tell us about the barriers to access the fertility treatments and assisted reproductive technologies in underprivileged communities, and the role of the International Fertility and Gynecology Obstetrics Foundation for Gynecology and Obstetrics that plays in that area?
Thank you very much. Thank you very much, and I'm very glad to be among the distinguished panelists, and thanks for inviting me and inviting FIGO, the International Federation of Gynecology Obstetrics, for this important panel. The point of departure for FIGO is women's rights and women's health. And FIGO stands as a global agency in that regard. Our main task in the 132 countries where we have national societies, including nationalities of the panelists sitting on this forum, we aim to look at issues from the ethical perspective and from the medical and the clinical perspective. We have specialized committees in FIGO that looks at the personal factors affecting seeking fertility, and also looks at the social factor in addition to the other technical factor within the context of every country and with the respect of the existing cultural determinants in every country, but of course stressing all the time the right of the woman and the justice to women. So in that regard, we look at the financial restrictions and try to encourage national societies to work with the governments. We look at the cultural slash religious slash traditional restrictions, and we try to overcome that by education, by advocacy, by reaching out to underprivileged women. We also look at family restrictions and also community restriction by working on the couple. We also work on the financial restrictions. In many places, these are public services. In many other places, these are services that are not covered. So besides the religious part, there is so much problems that are facing those couples and women seeking fertility, that looks at the financial to be overcome, that looks at also dominance over women in many communities, especially if they are blamed for the fertility issue. Also, we have to look at the health system challenges that might not be or might be covering the waiting time for those people, the factor of age vis-a-vis the working time. And at the same time, we try to create educational level for the psychosocial aspects, as my colleague said, for the emotional component and the emotional aspect, and at the same time, work through our ethics committee to relook at certain policies and certain procedures within cultures, within the religion, to make sure and to ameliorate that there is no genetic injustice. Because if you notice, all the discussion is going around the biological factor, which is not fair, I think, for women, and is not fair in view of the progress that IVF and medicine have done, that to zoom it down only to biological and to genetic factors. So this is the kind of injustice also we try to assess within the existing policies and the procedures of every community and every country, working with our 132 societies. And as a matter of fact, over the past 15 to 20 years, there is really a significant improvement, as has been reported by our national societies, regarding more women and more couples accessing fertility services. More couples, more women are knowledgeable about the fertility services and the chances they are going to have in the future in case they have also fertility problem. One last message I have to send to, I have listened to all the other panelists, and I think there is a lot to be done within the religious procedures and policies. I've heard the view from Iran. There is much more probably accommodation for issues related to infertility. I think we should think of accommodation, keeping in mind that our point of departure is women's rights and women's health. And thank you very much for being here. Thank you.
Thank you, Dr. Al-Kaka. If Professor Sroor and Dr. Ghali allow me, because you will be leaving, you have to leave in 5 minutes, so I will address you one of the questions that came to us through the Q&A before we move on with the remaining panelists. You talked about the financial situation. This instability also in many Arab countries is pushing a lot of the younger couples, especially the ones who are on an academic path and trying to build a career, to push the decision of having a baby a little later in their life. In this case, do we deal with ART like precision medicine as a preventive measure, and we freeze their embryos at an early age? Because, for example, I heard from a couple in one of the Arab countries who said financially we cannot afford to have a child before the age of 48. So they will definitely be infertile by that age.
Thank you very much. It's a very interesting question. We don't have time to tell you about the really scary numbers of the mean age of singlehood in the Arab region. In the Arab region, more and more men and women are marrying at a later age. And numbers are really scary if you look at the population pyramids and look at these numbers. This is being said, besides the profession and the financial and everything, I think as a person, and I think as a FIGO institution, we definitely push for egg freezing, and we push for basically egg freezing because the sperms are different, to give those people a preemptive chance to have a family and to have kids and babies in the future without being seriously burdened if they go for a career and if they go for a track to make their own financial security and other level of security. Definitely, we are behind this, and there is so much progress on the level of egg freezing, and there is now, besides egg freezing, there is the ovary freezing for different reasons, but this is technology that's evolving by the day.
And becoming less costly by the day. Thank you very much, Dr. Al-Kak.
We hope so.
Professor Sroor, as a pioneer in the field of IVF, what consultations did you have with religious scholars around the moral and ethical issues surrounding infertility treatments, and how did this contribute to raising public awareness?
Well, thank you very much for the invitation, and thanks for the excellent panel. But I must say, when IVF started on the 25th of July in 1978, when Louise Brown was born, so we obstetrician gynecologists in the Muslim world were wondering whether we can apply this technology in the Muslim world or not, because for the first time, sex was separated from reproduction. So at the end of the year 1978, I went to the Grand Sheikh of Al-Azhar, Professor Gad al-Haq, Ali Gad al-Haq, and at that time he was the Mufti of Egypt. So I informed him about this practice, and I said, well, this is new technology which is happening. So, sir, what can we do? So I explained to him all the scientific aspects of it, and that was by the end of the year 1978. So after a couple of months, he called me and he handed me his fatwa, which was issued on the 21st of March 1980. 21st of March 1980. So that's 40 years ago. And he dealt with all aspects of the issue, including practices which were not done at that time. And he indicated that if there is an indication for assisted reproductive technology, provided that the egg is from the wife and the sperm is from the husband, and the embryo is transferred to the uterus of the wife, who is the owner of the egg, during validity of the marriage contract, then it is allowed, permitted, and indeed it is encouraged, because it preserves the family and the continuation of humankind, because procreation is one of the objectives of Islam. And based on this, actually, we could introduce IVF in the Muslim world, where we started the first IVF center in Egypt in the year 1986, and at the same time in Saudi Arabia, and the first baby was born in the Muslim world in the year 1987. Having said so, the fatwa of the Grand Imam Sheikh Gad al-Haq, Ali Gad al-Haq, did not only talk about the issue and whether it is haram or halal, but also it talked about all the practices which you are practicing today and were not existing at that time in the year 1980. He talked about egg donation, he talked about sperm donation, he talked about surrogacy, he talked about genetic manipulation, he talked about sex selection, and and he talked about so many aspects. He talked about cryopreservation and freezing, which is really very impressive. And I refer all the participants here to go to that fatwa, which was issued in the year 1980. Now, providing this information to the religious leader has been very encouraging, and consequently, this dispels misconception about the position of Islam on these issues. And when we started IVF, people didn't like to be identified. And even when we call them at home and say, this is so-and-so, the drug, they say, what? IVF center, we have nothing to do with this. No. And they refused. And when they used to come to the center in the year 1986, they didn't want at all to be called by their names. We had to identify them by numbers, because people were feeling ashamed, that they are coming for IVF. And they will never, ever tell their sisters, their even mothers, or even their neighbors that they have had to IVF. Now, because of the support which we got from the religious leader, now we get the patients coming and say, how did you know about the center? She said, oh, my neighbor, she said she came here and she had an IVF baby, so I came to have it. Or someone will say, because a friend of mine, he told me that he came to IVF and he has it. So this actually removed the shame and the misconception about the position of Islam. It became very acceptable to the world, and people, in fact, they do come for us now asking for IVF, and I tell them today, sorry, see, IVF is not suitable for you. You should not have IVF. And they should say, oh, but I want to have IVF. And then I explain why it is not suitable for her. One of the issues which was raised with my distinguished panelists here about the difference in the culture and the difference in the ethical perception of this. And this is very important. This is the issue of conscientious objection. Of course, we do live in a small world, we do live in a village, and it is not uncommon that the treating physician has a different ethical perception from his patient. I have a certain ethical percept, and my patient has a different ethical percept. I'm a Muslim, I might be treating a couple who are non-believer, or I might be treating a couple who are Catholics, or I might be treating a couple who are Protestant, and so on. So we have to understand this very well. We have to understand that ethics are based on the moral, cultural, and religious and philosophical background of the society. And it is not necessary that my ethical principles will be similar to my client. And that's why we have to accommodate for this conscientious objection, what we call as conscientious objection. If I have a conscientious objection to provide a certain treatment, like say egg donation or sperm donation or others, and my patient, she has no objection for this, it is an obligation from the ethical point of view that I refer her to where she could have the treatment which suits her ethical perception, provided that this treatment is based on good scientific evidence and is not harmful for her patient. Otherwise, then we are taking the paternalism of medicine and trying to impose on our patients what we believe. But also similarly, vice versa, as much as it is my duty to respect the ethical perception of the patient as well has, and the institutes as well, health institute, has to respect my ethical perception as well. In other words, the doctors or healthcare provider should not be forced to provide a treatment for which they do object, because it is a reciprocal right, the right of the patient and the right of the couple. And of course, even say with the new technology, I mean, for the freezing of eggs, yes, they are performed either for medical reasons or for social reasons. But when we do them for social reasons, we got to really tell our patients, about that if they are going to keep their egg, they should keep it only for a limited period of time. And the fact that she wants, one of my colleagues said that at the age of 48, we have to tell the patient that the pregnancy at the age of 48 is associated with complications and is associated with high risk for the mother. So really we have to, when we provide this new development in the technology, we have to be aware about this. Sex selection, we do get now patients coming for sex selection. Of course, for medical reasons, that's no problem. But if they are coming for social indication, we don't offer it to families if it involves discrimination against one sex or another. In other words, we should never provide it for families who don't have children at all, and they want to have the first child as a boy or a girl. We should not provide it to the family who have both sexes, the boy and the girl, because they already have both sexes, no matter they have 4 girls and 1 boy, and they want another boy. No, that's not, because God has given them both sexes. We should not provide it for providing only one sex. In other words, either a boy or a girl. And if we do this, we are providing it without discrimination against either sex, whether the male or a female. And we are doing this because, as all of us know, we are living in a part of the society where reproduction is essential, and reproduction is a must actually for the families. And if the family, say, have 4 children, girls, and they want to have a boy, yes, they have the right to do this, or vice versa as well. Because if we don't offer her this service, then what will happen? The wife will go on getting pregnant again and again and again. And this, of course, will get her in high parity. And Dr. Faisal tells us that with the high parity, there's increased risk for the mother and for the child, and she is exposed to complications.
And there will be also an imbalance also in population in the end. So this is, you touched upon many of the questions that came to us through Q&As, and we're running out of time. So I have to go to Dr. Ghali about...
I must clarify that the imbalance of population is not really a problem because all the babies born till today, there are only 8 million. So 8 million in 7 milliard, you know, they are not going to cause
imbalance.
They don't cause imbalance, no.
But I know some couples who go for IVF to choose specifically a boy, and in this case, you answer the question that no, you refuse to give IVF for such couples. Dr. Ghali, the star of the Q&As is egg freezing. Apparently, it's an issue concerning a lot of women. We received so many questions about it, and we had already wanted to touch upon this topic with you. Egg freezing, in the report, you say it's already accepted when a patient is in cancer treatment, even if she's unmarried. But you say that we could look into social reasons for egg freezing before marriage. What kind of social reasons?
Yes, first of all, I want to thank very much my colleagues and the panel here and the co-chair of the forum, Dr. Ali Abdelhadi, and great colleagues who contributed to the report, Maha Al-Akoum from WISH and Dr. Aisha Youssef from Sedra. About your question, and I send my greetings to Dr. Gamal Surur. I met him a couple of years ago. I don't know if he still remembers, but it was a great meeting when I started thinking about these issues. About freezing eggs, as we explained in the report, for medical reasons, no question, even for social reasons, in principle, there is no strong opposition to doing that for women, even if they are single, unmarried yet. The main issue why we didn't say yes, it's possible and anybody can ask for this, we said that it should judge it on a case-by-case basis by an ethics committee consisting of different members, not only clinicians or scientists, but also patients, advocacy people, people with religious knowledge, etc. Why is this the case? Because there is a possibility for modernizing discrimination against women. At least this is my personal opinion. I don't want other colleagues to take this responsibility. We had the initiative a couple of years ago from tech giants like Apple, Microsoft, and Google, giving the opportunity to women in these big companies to have the package of freezing their eggs as part of their health insurance. Why? Because they found that women make career in the period when they have the most fertility, the best fertility age. And if they get children, they lose in the race of career against the men who do not have these pressures. So they can do this. I personally have great preservations against this, and I see this as disguised and modernized discrimination. If we have a problem in the work floor and in the career that do not respect and pay due attention to the nature of women, then we have a problem not with the woman to give her health insurance to change her nature and to postpone her plans for having family. Now we have a problem with the work floor that should change. So I find here a problem. So if we made it open that anyone can do it, it's we legitimize.
But your angle is rightful when you look at it from a married couple. If a woman is already with a partner, with her life partner, and she's postponing having a baby for her career, then discrimination in this case you might be rightful in this. But if we are talking about women who are still in the process and their career is taking most of the time, that they're not finding the suitable partner yet, then it's a solution.
It's true. If they are unmarried, I couldn't find still the right partner, yes, that's fine. But if I have the right partner, not yet married even, but I'm afraid if I get married, I will lose the opportunity in my career. This is what will disturb the society. Work floor should change. Work culture should change and be accommodative for special concerns for the women. They cannot compete on the same level like men in the name of equality and stuff like this. I have problems with that. But if it is the choice of the woman, imagine there is a woman who cannot find a suitable partner at the moment for whatever reason. Why not that she can do this?
You have a question from a viewer from Lebanon. What is Islam's position on social fertility preservation of unmarried women, and how's virginity addressed in this case? Is hymenal repair post to the procedure accepted in this case?
For getting the eggs, I don't think the colleagues know this more, but I don't think it will affect virginity. It's just
so from a religious point of view, there is no actual opposition.
Yes, in our study,
to
we didn't find strong preservations against inherent observations. It may be procedural, that for instance these eggs can be used outside marriage, but the same for even married couple, they can be used also. So there are no inherent bad problems with freezing embryos, freezing eggs, I mean.
Okay, Dr. Tremaine, you talked also about if you have a comment regarding the egg freezing, is it a discrimination against women, or is it a chance like Dr. Al-Kak suggests? And I have also a question about how can we solve on a global scale the anonymity of donor issue?
Well, concerning freezing eggs on the personal request, if it is on a personal request because of the social circumstances of the woman, because she hasn't met the right guy to marry, or her circumstances does not allow her, there's no objection at all to take her eggs, freeze the eggs. But when the eggs are being used, then they has to be fertilized by the sperm of her husband and transferred to her uterus. The objection is, as my colleague mentioned, that when they are being used by employees and companies, the big companies, they don't want their employee to get pregnant because this will affect their production and they will be entitled to maternity leave, etc., etc. So some of the companies, particularly in some of the Western countries, some of the countries in the West, they make a condition that their female employees don't get pregnant during their career, and they compensate them by providing and supporting freezing their eggs. Now, concerning taking the eggs from an unmarried girl, it is possible without affecting virginity, because in this case, we do the pickup through the abdomen. Instead of getting the eggs from the vagina, from down below, we stimulate the ovaries, so the ovaries are big enough, and we can introduce the needle through the abdomen under ultrasound guidance, and we can get it outside. Well, of course, donation, these eggs should not be used for donation. They have to be used by the same patient, but also we have to warn her that she should not keep them till late in life, because pregnancy after the age of 40 and 45 is actually associated with increased risk. So advise her, if she decided to use
pregnancy.
Yes, absolutely. Should use it as early as possible.
We have a question about surrogacy as well. The report recommends that Islam goes against, or Sunni Islam, to correct it for Dr. Tremaine, Sunni Islam goes against surrogacy. But in Islam itself, breastfeeding was okay. Can't we compare when you take the embryo from the husband and wife and implant it in the uterus of another woman? Can't we compare it to breastfeeding and use the same legally binding, like children of the same, coming from the same uterus cannot get married?
Thank you for the question. Actually, this is a matter of dispute among the religious leaders in the Sunni world. Some of them, they approved it, some of them did not approve it. But the development of science now, the recent science had shown us, even inside the uterus, though the genes of the child is not being affected in the surrogate mother, yet the environment inside the uterus itself has an impact on the health of the child to be born during childhood and even late in adulthood, and even development of diseases later on in life. Plus, of course, if you are a carrier of a baby who is not yours, then you don't care about exposing the baby to some of the risks like drinking, like taking too much coffee, like being exposed to pollutants, like being exposed to X-rays, like not taking certain antibiotics at a certain time. So really, you are not working all the time for the benefit of the child. Furthermore, no surrogate mother can be put under strict observation from the donors, from the owner of the embryo who has been inserted intrathecal. So it is a matter of dispute, but the development of the new science actually goes in the direction that we should not really allow it.
And there's also the ethical concern that she's practically using her body for other purposes. She's selling her body in other ways. So it's a very, very big dilemma. I'm very sorry for Dr. Tremaine and Dr. Abdelhadi. We run out of time. This is a conversation that needs to be going on and on every year, and I guess every month if we can. Thank you, my distinguished guest, Dr. Mohammed Ghali, with me here, Professor of Islam and Biomedical Ethics at HBKU, and forum co-chair, this forum co-chair, Dr. Alia Abdelhadi, also the co-chair of this forum and chair assisted of Reproductive Center at Hamad Medical Corporation. We had with us also Archbishop Vincenzo Paglia, the president of Pontifical Academy for Life, and Dr. Soraya Tremaine, founding director of Fertility and Reproduction Studies Group at the Institute of Social and Cultural Anthropology at Oxford University. Dr. Faisal Al-Kak, he was with us from Beirut, vice president of International Federation of Gynecology and Obstetrics, and Professor Gamal Srour, professor and director at an International Islamic Center for Population Studies and Research at Al-Azhar University. Thank you, everyone. Stay safe and stay healthy, and meet us tomorrow for the last panel.